In this video, we're going to go over the Assess and Treat panel. We're going to be starting with a PCR that we started in earlier videos. And the first section here that we're filling out is patient condition, and these are what we call driver questions. So depending on what you select here is going to drive what panels are visible and various validation rules based on the patient type. As an example, when we click on the trauma button here, it's going to make the potential injury panel visible, where obviously if it was a medical patient, there wouldn't be any injury. So for this one, we're going to document a cardiac arrest. So we'll make it a medical call, and it's a cardiac arrest call. And you see when we select that, it puts the 12-lead EKG STEMI panel available and the cardiac arrest panel visible. Please make note of this, because if you forget to select this or select the wrong one and you're trying to document a cardiac arrest and you don't find the panel visible here, this is likely what's driving it right here. Now, it's a good rule of thumb, if your call is completed and you're working on a medical call and the patient was hooked up to the EKG, or you have any data on the EKG, and hopefully by now you are all importing every call on EKG to get your vital signs in and any of the other indicators that the LifePak 15 pulls for you. So on this one, we're going to go ahead and import an EKG case. Now you have two possible selections here: Elite Desktop Client and Physio Control Cloud. The desktop client is if you are physically attaching your LifePak 15 to your computer to import the data, which we don't do. All of ours are going to be through the cloud. And the way this is set up is when you transmit your data from the LifePak 15, it's going up to the Physio Control LifeNet Suite cloud, and from there it's being sent to ImageTrend and being made available for you to download. So this is considerably better than what we currently have on ImageTrend, although it can be a little bit slow if you're on a cellular connection and you've got a detailed call that you're downloading. So we'll go ahead and select the Physio Control Cloud, and then you want to find your case on here, and what I'm going to do is I'm going to import a STEMI case. So I know that Medic 14 ran a STEMI on October 16th at about 5 a.m. And let's see, that looks like it's it right there. So we'll go ahead and click on the button here to download it. And again, this may take a while. We've had to take actually several minutes for a cardiac arrest call that was being transported down to Cottage Hospital. Now, once the import is done, it's going to open up the timeline field, and that's just going to show you where the vital signs were placed in the timeline of your call. Now, this is off a bit because the case that we imported was actually ran days before the CAD data that we downloaded, so it doesn't match at all. Typically when you import this, these fields here, these red fields, are going to be in between. Most of them obviously are going to be after your unit arrived on scene. For now, we're just going to go ahead and hide that, and then we'll address those imports when we get down to the treatment and vital section. So we'll move on to the complaint and impression. And our first field here is the time date of symptoms onset or last seen normal. Now, obviously, this is critical for our stroke patients. And if you are filling this out as you go, which I'm thinking most of you are not, you can just enter in the time clock there, and it's going to put the date on. Another good way of doing it is if you put your cursor on one of these fields. If you look over here at on the left, it's going to show you the current date and time, your on-scene time, patient arrival time, and destination arrival time. So you can click on any one of these, and you'll see it changes the times down here. So if you say that the symptoms started about 5 minutes prior to arrival on scene, or we'll say 2 hours prior to arrival on scene, you click on the on-scene time, and then just hit the minus button here, and that'll give you the proper time over here. Patient complaints. This is again a grid field, so we'll open that up. You'll denote what type of complaint it is, and this one will say it's a primary complaint. And again, this is in the words of the patient, or essentially a free text entry of what the complaint is. Duration of the complaint, we'll put down 2, and then hours is the unit, and then click on OK. And see, that'll show up in the grid there, and then you can add a secondary complaint if you'd like, secondary or other. For the purposes of this, we won't do that. Now this section gets a little messy. Not sure I like the way that they do this, but it is what it is. So it's best to just go from the top and work your way down. The chief complaint anatomic location, just give it your best guess. We're going to try and clean this up later and maybe hide these or make these not mandatory, where if the chief complaint is a medical condition, maybe we don't care what the anatomic location is. But just fill it in as best you can. We'll put down cardiac, cardiovascular, and then your primary impression. And again, give it your best guess. Do not select other unless you absolutely have to. And then just a heads up, that's going to be monitored pretty heavily. Anybody who selects other in any of these is going to be scrutinized, and it's not a good idea to do it. Just saying. Work-related injury, we'll say no. And then this section is complete, and you'll see it turns blue, and we'll move on to the next one here. Now in the exam section, this is quite a bit different from what you're currently doing. One thing to note, well, body weight is being brought forward by the patient section where you enter that in, but the ALS assessment performed and warranted, this is just like your vehicle type or the level of care for your vehicle. It is always going to be an ALS assessment. You have a paramedic on board, even if it's a BLS transport, the paramedic needs to make contact with the patient and verify that it can be performed by a BLS personnel, and that is going to be an ALS assessment. So this should always be yes. Now on the exams, there's 2 ways you can do the exam. One is easy and one is extremely complicated. So when we open this up, if you'll scroll down, all these are red. So skin assessment, head assessment, face assessment, and a lot of these are kind of ridiculous for any kind of a call. Obviously, we probably don't want to do a face assessment or wouldn't do one on a cardiac arrest. So my suggestion is, rather than using this, although you certainly can if you got a couple hours to spare, use the assessment tool, assessment power tool here. So this one is laid out much better. It's very intuitive and clean, self-explanatory. You simply enter in the date and time of your exam, and then you have all your different exams here. For example, you can just click on normal, not done. And these are all toggles, so you can toggle it on and off. You click the items that are pertinent, and then there's a not present or not pertinent tag right here. If you click on this, it's going to allow you to make that a non-present finding. Then up here on the right hand side, there's the details button. This is on all the exams. If you need to add additional free text details, just click on this here, then you can just type in what you want to enter. And also over here on all the items where you've got 2, it'll give you the option for left or right. And again, here's all your choices down here. I really like how this works. The only drawback is that it doesn't show you any of the red fields or required fields. So at the taping of this, there's quite a few of them, but I think EMS is going to drop those down, so it might not be that big of a deal. Let's just go through a few of these here. Oh, make these so they make sense. Let's start normal. Yeah, let's give them some trauma here. Alright, so we'll click on OK, and then we go down here to the exam. You'll see there's head assessment, face assessment. So these are still things that are required. And you notice kind of weird. It adds, since it's through a power tool, it adds all these other exams that are available to you. But they're just defaults. There's nothing to worry about there. So this is, although we don't advise going through and finding the red spots and just addressing the red spots in this section, that's exactly what we think you should do. So just scroll through here. This is one that is required by the county that we didn't do. Again, this is one of the ones that I hopefully will get removed off the mandatory list, because we don't want people doing pelvis exams on all their patients. Now, one other thing here, if we click on OK, if you want to try and delete something like this, it's really anything that's developed in a power tool has to be modified or deleted within the power tool. So you'll see here when we try and delete it, it's going to say that it can't do it, and once you open it up in the power tool, and it takes you right back here. So if you're doing multiple exams, if you want to add a second exam, you can, rather than just clicking OK here and then hitting the assessment power tool again, you can just click on add new, and it's going to add a second exam for you. Stay away from this here. This turns everything normal, which unless you're actually doing an exam in all these places, you're not going to want to do that. And it looks like it's not a toggle either, so once you click that, you're done. You got to go through and unclick all these manually. And I think that's it. Again, this is a very good choice for doing your exams.